How can parents look at a completed assessment and determine if it's a valid and reliable assessment? What do we need to look for? Again, you're looking for if this looks like your child, but like I really like the way that you break it down.
Yeah, I mean, I definitely think that's the kind of most basic answer is, if you're reading this assessment and this report, does it sound like your child? Does it sound like the person you know? Because at the end of the day, you know your child better than anyone. And a lot of these assessors, especially if it's in the very beginning, if this is an initial, don't know your child at all, aside from the very little time they've spent assessing them. So that's the first point is, does it sound like this can be your child? And if not, probably something is off. However, I also will ask parents, like, have you observed your child at school? Because kids do, perform differently in different settings. So it's possible. Have you sent anyone to observe? Have you requested that they send videos? If you have a lot of questions, I definitely recommend that. Other things to determine the validity, we kind of touched on last time, how long did they actually spend with your child? I actually had one this week where collectively the psychologist and the speech therapist combined only spent 40 minutes total with this child. Like, that's insane. So you obviously can't really discern much with 20 minutes with a student and then write this whole report and make a determination. So time, also looking at the testing instruments used. We touched on this last time too. Assuming this is a child where this isn't the initial assessment, if you know that your child has, for example, an underlying expressive language disorder, and then the only cognitive instruments they're using are verbal, then their cognitive scores are going to come out low because of an underlying language impairment. As a parent, you have to really kind of know that and be mindful of saying, well, did you do any nonverbal cognitive measures to kind of remove that confounding variable, right? Like, obviously my child is going to present as much lower performing if you're requiring all this verbal output when he has an expressive language disorder. So that's a huge piece to the validity, is taking into consideration the child as a whole. So the biggest one I see oftentimes. Also, attention is huge. If you have a child with like ADHD and then it's coming out as there's all these low scores, like, how much of that is impacted by the attention? Is it truly that this student can't produce these skills and can't perform, or is it being confounded and impacted by the attention? So that's really the bigger picture of really parsing out, the assessments as a whole.